COVID-19 and its hidden impacts. What if the pandemic's effects go beyond respiratory health, impacting your most private concerns? The COVID-19 pandemic has swept across the globe, leaving a trail of devastating consequences in its wake. While the immediate impact of the virus on respiratory health is well documented, there's growing concern about its long-term effects, particularly on men's sexual health. Emerging research suggests a strong correlation between COVID-19 infection and erectile dysfunction, ED. This comprehensive guide aims to shed light on this often overlooked aspect of the pandemic, providing insights into the connection between COVID-19 and ED, its causes, symptoms, and potential solutions. How has COVID-19 affected you or someone you know? Share your experience below. Understanding erectile dysfunction, ED. What exactly is erectile dysfunction, and why does it matter so much in understanding COVID impact? Erectile dysfunction, ED, is defined as the inability to achieve or maintain an erection sufficient for sexual intercourse. It can be a significant source of emotional distress, impacting self-confidence and intimate relationships. ED is often a symptom of underlying health conditions such as heart disease. It can also be caused by the aging process, problems with arteries and veins, nerve issues, medication side effects, cancer treatment side effects, hormonal imbalances. Understanding the underlying causes of ED is crucial for effective treatment. Have questions about ED? Drop them in the comments for more clarity. COVID-19 and circulatory health, the link to ED. How does a respiratory virus like COVID-19 disrupt your body's blood flow and sexual health? Adequate blood flow is essential for achieving and maintaining an erection. COVID-19 can damage blood vessels throughout the body, including those supplying blood to the penis. This damage occurs due to inflammation. COVID-19 triggers a hyperinflammatory response in the body, releasing inflammatory cytokines that can damage the lining of small blood vessels. Blood clots. Inflammation caused by COVID-19 can lead to the formation of small blood clots, further disrupting blood flow to the penis. The fragile blood supply of the penis is particularly vulnerable to these effects, leading to compromised vascular integrity and erectile dysfunction. What steps are you taking to support your vascular health? Let us know below. Testosterone and COVID-19. Could COVID-19 be silently lowering testosterone levels and affecting your vitality? Testosterone plays a vital role in male sexual function. Research suggests that COVID-19 infection can damage the Leydig cells in the testicles, which are responsible for testosterone production. This damage can lead to decreased testosterone levels, contributing to fatigue, reduced sex drive, decreased muscle mass, erectile dysfunction. While the long-term impact of COVID-19 on testosterone levels remains unclear, the potential for hormonal disruption adds another layer of complexity to COVID-related ED. Do you know your testosterone levels? It might be time to check. Long COVID and its lingering effects on sexual health. What is long COVID, and why might it be affecting your intimate life months later? Long COVID refers to the persistence of symptoms weeks or months after the initial COVID-19 infection. Erectile dysfunction has emerged as a potential symptom of long COVID, further highlighting the virus's lasting impact on sexual health. As research continues to uncover the long-term consequences of COVID-19, understanding the link between long COVID and ED will become increasingly important for patient care and treatment. Have you or someone you know experienced lingering COVID symptoms? Share your journey below. The role of anxiety and stress in COVID-related ED. Could pandemic stress and anxiety be compounding the physical effects of ED? The pandemic has brought unprecedented levels of psychological stress, with social isolation, fear of illness, and economic uncertainty taking a toll on mental health. This psychological burden can significantly contribute to ED. Increased rates of post-traumatic stress disorder, depression, and anxiety following the pandemic are anticipated, potentially exacerbating ED in both those who survived COVID-19 and the general population. How do you cope with stress? Share your tips to help others in the comments. Identifying the symptoms of COVID-related ED. What are the subtle signs that COVID-19 may have impacted your sexual health? The primary symptom of COVID-related ED is the inability to achieve or maintain an erection sufficient for sexual intercourse. However, it's essential to consider other potential symptoms and risk factors. Recent COVID-19 infection, regardless of severity. History of severe COVID-19 symptoms, particularly high fever. Pre-existing conditions like diabetes, obesity, high blood pressure, and circulatory or neurological diseases. Psychological distress, including anxiety, depression, and post-traumatic stress disorder. Recognizing these symptoms and risk factors is crucial for seeking timely medical attention and appropriate treatment. Have you noticed changes in your health post-COVID? Let us know below. How inflammation affects sexual health. Could inflammation be the silent culprit behind COVID-related ED? Inflammation is a key player in the development of COVID-related ED. The virus triggers an intense immune response, leading to a cytokine storm, a surge of inflammatory chemicals that can damage blood vessels throughout the body. This inflammation damages the delicate lining of blood vessels, impairing blood flow. Increases the risk of blood clot formation, further disrupting circulation. Can directly damage the cells of the penis and testicles, affecting both erectile function and fertility. Addressing inflammation is crucial for mitigating the impact of COVID-19 on sexual health. What anti-inflammatory foods or habits do you rely on? Share your ideas. Lifestyle changes to combat COVID-related ED. Can simple lifestyle tweaks help you recover from COVID-related ED? While research is ongoing, several lifestyle changes may help manage COVID-related ED. Healthy diet, a diet rich in fruits, vegetables, and whole grain supports healthy blood flow and overall cardiovascular health. Smoking cessation, smoking damages blood vessels and exacerbates erectile dysfunction. Limit alcohol consumption, excessive alcohol intake can negatively impact erectile function. Manage stress, techniques like meditation, yoga, and deep breathing exercises can help reduce stress levels, potentially improving ED. These lifestyle modifications, combined with medical guidance, can contribute to a healthier lifestyle and potentially improve erectile function. What's your favorite healthy habit? Inspire others by sharing below. Exercise and blood flow, restoring your performance. Could your fitness routine hold the key to restoring vitality and intimacy? Regular physical activity is crucial for maintaining optimal cardiovascular health and improving blood flow. Exercise helps strengthen the heart muscle, improving its ability to pump blood efficiently. Dilate blood vessels, enhancing blood flow to various organs, including the penis. Reduce stress and improve mood, positively impacting sexual function. Incorporating exercise into your routine can be a powerful tool in combating COVID-related ED and promoting overall well-being. However, consult with a healthcare professional before starting any new exercise program, especially if you have underlying health conditions. It is important to note that much of the information surrounding the long-term impacts of COVID-19 is still developing. While these sources offer valuable insights, further research is needed to fully understand the relationship between COVID-19 and erectile dysfunction. Seeking guidance from a healthcare professional is crucial for personalized advice and treatment. What's your go-to workout for staying active? Share your fitness tips in the comments. The psychological impact of ED post-COVID. How does ED affect not just your body, but also your mind and relationships? Experiencing ED after recovering from COVID-19 can significantly impact a man's mental and emotional well-being. It can lead to feelings of inadequacy, anxiety, low self-esteem, depression. These emotional repercussions can also strain relationships, causing reduced intimacy, communication problems, stress for both partners. It is crucial to address ED holistically, considering both the physical and psychological aspects of the condition. How do you maintain mental well-being in challenging times? Share your insights below. COVID-19's impact on cardiovascular health and ED. Could your heart health hold the answer to post-COVID ED? COVID-19 can have a lasting effect on cardiovascular health, potentially contributing to ED. The virus can damage the lining of blood vessels and increase the risk of blood clots, impeding blood flow to vital organs, including the heart and the penis. Research has shown that ED can be an early warning sign of cardiovascular disease, emphasizing the importance of seeking medical attention if experiencing ED after COVID-19. Have you recently had your cardiovascular health checked? Let us know in the comments. Diet and nutrition to boost sexual health post-COVID. Could your diet be the secret weapon for revitalizing your sexual health? A nutritious diet plays a vital role in supporting overall health, including sexual health. Certain foods and supplements may help improve erectile function and vitality. Foods rich in nitric oxide, NONO, helps to relax blood vessels, improving blood flow. Good sources include leafy greens, beets, and citrus fruits. Foods that support testosterone production include foods rich in zinc, such as oysters, beef, and pumpkin seeds, in your diet. It's also important to maintain a healthy weight and manage underlying conditions like diabetes and hypertension, which can contribute to ED. What's your favorite healthy meal? Share recipes or tips to inspire others. The role of sleep in recovery and sexual health. Could better sleep unlock better intimacy? Quality sleep is essential for hormone regulation, including testosterone production. Poor sleep, often exacerbated by COVID-19 infection or stress, can negatively impact testosterone levels and erectile function. Prioritizing sleep hygiene and establishing a consistent sleep schedule can help improve both sleep quality and hormone balance, potentially alleviating ED symptoms. What's your top tip for better sleep? Let's build a list of ideas in the comments. Building confidence while coping with ED. How can you rebuild confidence and intimacy while managing ED? Coping with ED can be challenging, but it's essential to remember that it is a treatable condition. Here are some tips for maintaining confidence and self-esteem. Openly communicate with your partner. Honest and supportive communication can strengthen your relationship and ease the emotional burden of ED. Focus on other aspects of intimacy. Physical intimacy involves more than just intercourse. Explore other ways to connect with your partner, such as cuddling, massage, and non-sexual touch. Seek professional help. A therapist or counselor can provide support and strategies for managing the emotional impact of ED. Remember that you are not alone, and seeking help is a sign of strength. What strategies have worked for you in maintaining confidence? Share your experiences below. Medical treatments for COVID-related ED. Could medical advancements offer hope for post-COVID ED recovery? Several medical treatments are available for ED, including Parade 5 inhibitors, e.g., Viagra, Cialis, Levitra. These medications help relax blood vessels in the penis, improving blood flow and facilitating erections. Shockwave therapy. This non-invasive therapy uses sound waves to stimulate blood vessel growth and improve blood flow to the penis. Penile implants. In severe cases, surgical implantation of a penile prosthesis may be an option. A healthcare professional can help determine the most appropriate treatment based on individual needs and medical history. Which medical options have you heard of or tried? Share your thoughts below. The role of hormone therapy in COVID-induced ED. Could testosterone therapy be the key to restoring vitality after COVID? If low testosterone is a contributing factor to ED, hormone therapy may be considered. A healthcare professional can assess testosterone levels and recommend appropriate treatment options if necessary. However, it's crucial to note that hormone therapy may not be suitable for everyone and should only be pursued under medical supervision. Have questions about hormone therapy? Drop them in the comments for discussion. Partner communication, strengthening emotional bonds. Can open communication transform your relationship, even when facing ED? Openly discussing ED with your partner is crucial for maintaining a healthy and supportive relationship. Communication helps to reduce feelings of isolation and shame, foster understanding and empathy, facilitate joint problem-solving and treatment decisions. Talking about ED can be difficult, but it can ultimately strengthen your emotional bond and improve intimacy. What's your best tip for effective communication with your partner? Share below. When to seek professional help? How do you know when it's time to consult a doctor about ED? It's crucial to consult a doctor, therapist, or specialist if you experience persistent ED symptoms after COVID-19 infection, concerns about sexual health or fertility, emotional distress related to ED. A healthcare professional can assess your situation, provide personalized advice, and discuss appropriate treatment options. Have you considered consulting a professional for health concerns? Let us know your thoughts. Regaining control over your sexual health. What's the first step to reclaiming your confidence and vitality post-COVID? COVID-19 has highlighted the complex interplay between physical and mental health, including its potential impact on sexual well-being. While the long-term effects of COVID-19 on erectile function are still being investigated, the available research emphasizes the importance of proactive healthcare and lifestyle management. By understanding the potential causes of ED, seeking timely medical attention, and prioritizing healthy habits, men can take control of their sexual health and improve their overall quality of life. What's your biggest takeaway from this video? Share your insights in the comments, and don't forget to subscribe for more health-focused content.